thank you all for being here today, and we really value for making this time for this. Just a quick note on how things will run. We got 30 minutes together. So the first 15 minutes will be a quick presentation from us, and then we'll spend the remaining 15 minutes on a live Q&A. And if we can get to answer your questions now, we'll reach out to you later. So I'm Murilo. Nice to meet you. I lead marketing for Beike Biotech International Department. I'm based in Bangkok, Thailand, at our partner hospital. So if you're here today because of someone that you love or that is close to you, a friend, a family member that is losing vision from an optic nerve condition like optic nerve atrophy or septo-optic dysplasia, you probably already spent some hours looking online and trying to figure out what's best for your loved one. It's hard to know what's real, what's just marketing, and what actually applies to you. So to help me today, I've got Dr. Mohammed. Dr. Mohammed works directly with all of our patients. Thank you so much for joining us today, Dr. Mohammed.
Good evening, everyone, and thank you for joining us. For those who haven't met me before, I am Dr. Mohammed Al-Zgoul. You can simply call me Dr. Z. I am the medical director of the international department at Beike Biotechnology in Shenzhen, China. My background in clinical medicine and ophthalmology, and over the years, much of my work has increasingly focused on regenerative medicine and international patient care. As an ophthalmologist, I have worked on evaluating and managing patients with wide range of eye disease, and much of my work has focused on retina and optic nerve assessment and other areas of visual science. So when I evaluate patients with optic nerve condition, I approach those cases first from an ophthalmologist perspective. And this has allowed me to combine my ophthalmology background with regenerative medicine when assisting conditions such as optic nerve atrophy, optic nerve hypoplasia, glaucoma-related optic nerve damage, traumatic and inflammatory optic neuropathy, and congenital conditions such as septo-optic dysplasia. A major part of my work now is reviewing these cases and speak directly with patients and families about a very important question. What can we expect from the treatment? If there is one thing years of the works has taught me, it's that the label on the diagnosis doesn't tell you much on its own. Two patients with the same diagnosis can have very different causes, very different degree of structural damage, different amount of remaining vision, and very different prognosis even. So rather than focusing only on the diagnosis, I try to understand the whole clinical picture. What caused the optic nerve damage? Is the underlying disease still active, or has it stabilized? How long has the damage been present, and how much useful vision remains? What's the imaging shows, or the examination shows, and what's the treatments have already been tried. From there, my responsibility is to be straightforward with the patient and the family. If I believe there is a reasonable possibility of benefit, I want them to understand why. And but equally, if there is a limitation or areas we simply cannot predict yet, I believe that needs to be explained just as clearly. Because when families are making a decision that's with this important, they deserve to the complete picture, not only the hopeful part.
Well said. Thank you so much for sharing that. That's exactly the tone we want for today. So let's get into why this matters in the first place, right? So by the time that the families they reach out to us, they have usually already tried a lot of different things, like glasses, vision stimulations, medications, and in some cases even surgery. And to be fair, those approaches they do help. They well, each case is different. None of that stop being important for us, right, doctor? And we always encourage the families to keep working with their ophthalmologist back at home or their doctor back at home. But most of those treatment, they're built to manage what's happening around the condition, like controlling pressure, calming inflammation, helping the eye compensate for what is lost. What they can do is to address the nerve itself, the actual site of the damage or underdevelopment. That's a separate problem, and it calls for a
Yeah.
different kind of approach. Yeah.
Right. And this is where the science start to be becoming really interesting. Think of the optic nerve as a cable containing more than a million tiny nerve fibers, all carrying visuals information from the eye to the brain. Uh, when we talk about optic nerve condition, there are two different situations we commonly see. Uh, with optic nerve atrophy, the nerve developed normally, but some of those fibers were damaged or lost later in life. That can happen for many reasons, such as glaucoma, inflammation, reduced blood flow, trauma, compression, or hereditary conditions such as the labor hereditary optic neuropathy. Uh, the other side is optic nerve hypoplasia or ONH, which is different. In this case, the optic nerve did not fully develop during the pregnancy, so it's congenital. Sometimes ONH can be part of border condition called septo-optic dysplasia or SOD. These patients may also have problem with pituitary gland and certain structure in the brain. So in SOD, we may be dealing not only with vision, but also with hormones and development. Either way, the challenge is that once those fibers are lost or never fully develop, they have very limited ability to regenerate naturally. For many years, that was essentially where the discussion ended. But today we understand that the situation can be more complex. Around the affected nerve, there is usually ongoing inflammation and poor blood flow, and often fibers that are technically alive but not really functioning. We sometimes call them or call these sleeping fibers. A damaged or undeveloped optic nerve may still contain surviving retinal ganglion cells and nerve fibers that retain some function, right? Uh, this is where stem cells research become interesting. And I want to be very clear also, like stem cells are not simply rebuilding or completely rebuilding completely damaged optic nerve, and they cannot create a new optic nerve where one nerve never developed. Instead, the idea is to improve the environment around the surviving nerve cells. Stem cells may provide neuroprotective and anti-inflammatory signals, support blood supply, and release growth factors and other signals molecules that help protect remaining cells and support their function. And in some patients, that may translate into meaningful change in visual function. Turn on your mic. Yep.
Oh, sorry. So just to be like 100% clear here with all of them, we are not replacing whatever care the patient is already getting, right? From their
Uh,
ophthalmologist, from an
okay,
endocrinologist. So we're not replacing
correct,
anything.
correct. Correct, not at all. It's a different angle on the same problem, supporting the biological environment around the nerve, while the existing eye care and hormone management where relevant continue in parallel.
Right. Just give me 1 second here because I think just the call to me is dropping.
Okay,
Sorry about that,
yes.
guys. Okay, so Dr. Mohammed, let's just get into the basics, right? Can you just tell us a little bit about what exactly are stem cells and where do they fit into the optic nerve conditions?
Okay, then the simplest way to think about stem cells is as the body built in repair crew. Cells with the ability to develop into other cells type the body may need, right? Which is why you may sometimes hear them described as blueprint. When it comes to optic nerve condition, there are a few properties that are especially important. Stem cells, for example, like may help support the repair or replacement of damaged or undeveloped cells around the optic nerve.
Mm,
They can increase neurotrophic factors, which is essential the body own growth and repair signals for nerve cells. They can also help regulate the immune response and
mhm,
reduce inflammation around damaged tissue. And importantly, they release a wide range of biological signals that may help protect the nerve cells that are still surviving and support them while the repair process is taking place.
mm,
And by the way, again, stem cells are not a cure for optic nerve atrophy or septo optic dysplasia, and we always careful not to present them that way. What we are really trying to do is support the body own ability to repair and regulate itself. And in some patients, that may translate into improvement in areas such as visual acuity, light perception, color perception, depth perception, visual field, or even night vision. With SOD in particular, because the pituitary gland can also be involved. Some families may notice change related to hormone function as well. And the cells we use come from umbilical cord. We combined umbilical cord blood stem cells with umbilical cord mesenchymal stem cells, all obtained from healthy, carefully screened donor following normal birth. And importantly, no embryonic or fetal cells are involved at any stage.
mhm. So for optic nerve cases specifically, can you walk us through how the cells are actually delivered?
Okay. So the program generally runs up to 18 days over the time. Patients receive 6 to 8 injections,
Mhm,
split between an intravenous infusion, intrathecal injection, and the retrobarber. It will depend on the individual evaluation. For
mhm,
patients older than 10, we may add the retrobarber injection. These are uh, given behind the eye, close to the optic nerve. But this is not something we use automatically for every patient. The treating physician decide whether it's appropriate with it if he can do it based on the individual case. Um, And across the full course of treatment, patient typically received 120 and 340 million cells,
Mhm.
together with a daily rehabilitation program and structure nutrition support throughout their stay.
Mm. Yeah, so talking a little bit more about the treatment locations. So we have two partners, one in
Mm.
Bangkok and another one in China. So in Bangkok, the stem cell comes together with the full rehabilitation program, like occupational therapy, focus on the eye stimulation, acupuncture, oxygen therapy. We also have transcranial magnetic stimulation just to stimulate the eye area, the optic nerve area. And in China, the families they have access to a higher dose of stem cells. Um, but there we don't have the comprehensive rehabilitation program compared to the Thailand center.
Yes.
So yeah, our representatives they work with each family, right, to find the best fit for their case. Um, so it's really based on their specific needs. So this during this evaluation, the doctor will evaluate and also say what is best for each case. Yeah.
Yeah. And I just want to mention one thing I always stress, um, how a patient comes into treatment matter as well. Good nutrition, stable routine, and being in the best possible general health can all help create a better foundation for the therapy. And the care doesn't stop when the treatment ends. Continue ophthalmic follow-up, which is very important. And for patient with SOD, endocrine and development follow-up should be continue as well, alongside our own monitoring after treatment.
Mm. Yeah, one thing I forgot to mention that also at our hospital partner in Bangkok, we also offer nutrition, which is quite important for all the treatments. So now that we're here, and if you're wondering what actually look like for you or for your loved one, I'm just want to walk you through it so you have an idea. So first, the patient starts reaching out to us via website, social media, or direct message, whatever is easiest. There is not really any commitment at this stage. It's just a conversation between patient and our representative. So someone from our team will get in touch with you within 24 to 48 hours. And then they start collecting the medical history from you, so Dr. Mohammed and the whole medical team can evaluate and understand a little bit about your specific case. So from there, we'll give you an answer, right? If we can treat you or if or not. Yeah. Um, if if we think that the treatment is good for you, we will start giving you some idea on the protocols, pricing, timings, the logistics, all the details. And if it's not a good fit, we'll also tell you, and hopefully we can guide you into a better treatment or a better solution for your specific case. So once the family decides to move forward, we take care of the coordination dates, and we stay involved throughout the whole treatment and after treatment.
Yeah, I want to be upfront about something also, because this is an area where we often see too much over promising online. Stem cells therapy does not cure optic nerve atrophy or septo-optic dysplasia. Any clinic promise a cure should immediately raise a red flag. We follow our patient closely, and interestingly, the two conditions show somewhat different outcomes, which is understandable, right? Because the underlying cause are very different. Uh, for optic nerve atrophy, based on our follow-up data from 169 patients across 396 follow-up forms, around 6 out of 10 patients, 62% of them reported some improvement in quality of life, while 60% said they were satisfied with the outcomes. Uh, the change most commonly report by the patient or the families include improvement in light perception, the ability to detect hand movement, eye pain, and visual field. Uh, for septo-optic dysplasia, based on 115 patients across 278 patients, or follow up the form, the number were somewhat higher, around 81% reported an improvement in quality of life, and 83% said they were satisfied with the outcomes. And in this group, some of the most commonly reported change involve light perception, nystagmus, which is involuntary eye movement, and stropomas. Uh, when we see, when we explain improvement, or we say improvement, that can mean anything from a small function change to a much more noticeable improvement. The response is not the same for every patient, and this is something we discuss very clearly with families
Mhm.
once we have reviewed their individual condition. Uh, on the safety side, because the protocol may involve intravenous, intrathecal, and sometimes retrobarber administration. Some patients can experience temporarily mild side effect, which is such as low-grade fever, mild allergic type reaction,
Mhm.
and our medical team and partner monitor this closely and cover it in details during the evaluation. Another important point is that the change is usually gradual. We
Mm.
don't expect dramatic improvement during the treatment period itself. Instead, we continue to monitor the patient after they return home, and look at how their vision function develop over the following follow-up period. Uh,
Mhm.
and finally, every stage of treatment happens in hospital settings under medical supervision, from the initial evaluation through treatment, recovery, and follow-up. Uh, and our mesenchymal stem cells also have a US FDA Drug Master File Type 2 acknowledgement, meaning our manufacturing process and cell quality documentation have been formally submitted to and acknowledged by the FDA.
Mm.
When we are working with something as important as and sensitive as patient vision, that the level of quality control and medical oversight is extremely important to us.
Right. Well, thank you for mentioning that. Thank you for saying that. It's a big decision, right? And nobody needs to feel like they're being sold on a false hope.
Yeah, exactly right. And my job isn't to convince anyone. It is just to make sure they have what they need
Mm.
to decide for themselves.
Right, right. Well, I think we talked a lot, so let's open up for questions. Yeah. So, guys, if you have any questions, please feel free to drop your questions now on the chat. I We got over 50 confirmations for the for a webinar today, and a lot of questions already that you guys sent us on the forms. So I already got some pretty good ones that I will ask. Dr. Mohammed, and some of them I can answer myself. So let's just go ahead and start with the questions I have here, right? Okay. So, doctor, is there any realistic hope of vision restoration, reversal of blindness for people who are blind? And if so, what does the science what does the science currently support?
Okay, so like it's a big question, but maybe we start with answering it. There is a hope, but we need to be very careful about what's mean by restoration.
Mhm,
So, like as I mentioned, it's depend on the remaining visual function or surviving nerve tissue that it have. So, pre-examination before the treatment, very important to give a picture of what kind of improvement or if there's a chance of improvement for any case.
okay. Second question here. We have a 3-year-old child diagnosed with cortical visual impairment. Could stem cell treatment help in this case?
So, CVI, it's quite different from optic nerve atrophy because in CVI, the main problem is usually not the eye or the optic nerve itself. It's how the brain receive the process visual information. Uh, so like for his case what I suggest, submit the medical form, we request some examination and we can come
Mhm.
back to you with the answer, with the right answer and recommendation.
Right. It's case by case, right? So we need to check the medical history and then understand a little bit more. Next question. What are the risks and potential side effects of stem cell treatment in patients, including children?
So
We-
like over those long years and stem cells treatment show relatively like safe profile in clinical studies, not only in our centers or it's worldwide. But as I mentioned before, um, the side effects that we see, it's because of the procedure itself, and its mild side effect uh, could be low grade fever or a pain on the site of the injection.
Mhm. Uh, all right. Next question. Doctor, when will I start seeing improvements in my vision after the treatment?
So there is no specific day or week when we can see like improvement or when they can see improvement. It's gradual than immediate, and some families or patients will notice change with time, with the several months,
Mhm.
and some changes maybe the patient himself or themselves they can't see, which only with examination you can see those improvement, which is a structure improvement. So it's depend on the case also, and depend on the follow up.
Right. Yeah, but normally is around 3 to 6 months, right? After the
Yes,
procedure. Yeah. But some patients, even some patients they do see some light perception while they're here doing the treatment and so on. Okay,
yes.
next question. Does it matter if the condition is stable versus still progressing?
Okay, so this is very great question, actually, very good question. Yes, absolutely. Uh, Before thinking of stem cells, like if someone like has uncontrolled glaucoma or active inflammation or ongoing compression of the optic nerve, the first priority is to control that cause.
Mm,
Uh, as we mentioned, stem cells are not replacing those treatment, but after they staple the condition, uh, in this case, the improvement that they will gain, it will be at least like um, they will see some improvement, and or at least like slow down the progression of their disease.
Mm. Okay, next question. My child has SOD and autism too. Does that change anything?
uh, so like this is also like a good question, because
Mm.
we also see a lot of improvement for our autism patients, and we have a large number of autism patients. They come for treatment,
Mhm.
for stem cells treatment. So in this case, I think like stem cells can work in both direction, in the SOD and the autism. And he is welcome like to submit the medical form. We can evaluate the case and come back with the right recommendation for both SOD and autism.
Perfect. Yeah, and most we have a lot of cases that got both, right? SOD and autism. So and it can help with both conditions. Next question. What does improvement actually look like in real life, not just in percentages?
Okay, and this is also very important question, because improvement, as I mentioned, doesn't necessarily mean going from blindness to normal vision. So like maybe starting to respond to light, noticing hand moving, or following a face or toy, or reaching more accurate for an object. It's all like minimum improvement, but it's a huge improvement for the patient themselves, right?
Hmm. Hmm.
And for us as doctors also, like changing in the structure of the optic nerve or of the retina, this is also considered, if a minimum improvement, it's mean like a huge improvement for us.
Mm. Um, we have some time for, yeah, let's do one more question. How are the donor cells screened for safety?
So at our center, we do like a very large amount of testing before considering any donor, or even like considering the cells for treatment.
Mm.
Yeah, during their pregnancy, they will follow up a certain examination to ensure the safety of the donor themselves. And after
Mhm.
extraction of the cells, they also we run a lot of test for testing this tissue. And even like after during the expanding of the cells, we also ran uh, testing to ensure the safety of the cells. And what's everyone like has to know here, it's
Mhm.
we don't run those tests only by ourselves. We also send those cells or this patch to a third party lab that help to for testing, just to ensure the safety.
Okay. Yeah, one more question because this one is very interesting. How many injections will my child need, and if they are painful?
So as I mentioned, in our program, we patient generally receive from 6 to 8 administration during the treatment, with a period of 18 days. uh, so, and the way of administration, it's depends on the case. And if it's painful, for Richard Berber injection, we will do sedation. And for IV injection, it's a needle injection, which is I think it's the pain like maybe like could be handled, I think, by the patient. It's doesn't need a sedation for IV. Just in
Right.
case some of the children that they can't uh, do IV injection, we also like can do sedation for them.
Yeah, but normally they're okay with that, right? So especially
Yes.
only the I ones, just to highlight what you were saying. There's a local anesthesia, right? And some sedation in case the patient wants to be sleeping during the procedure, right? For both intrathecal in the back and also retrobulbar under
Virtual barber.
the eyeball. Yeah. Normally it's just like they don't really feel anything during the procedure. Sometimes they can feel a little bit of pain or it bothers a little bit around the eye and around the spine. So yeah, I guess that's it. If you guys don't have any other questions, I would like to thank you everyone for being here. Yeah, we appreciate you. So if you have any questions, oh, Anita has a question. Can you write down to us on the chat, please, if you have any questions? Oh, sorry. Oh yeah, yeah. So she said that my son is 14 years old. He lost in left eye vision due to ONA. No obvious reason. Now they're saying his microscopy changes in right eye nerve. Is the stem cell help to protect good eye?
Yes, stem cells can protect the remain optic nerve, like the remain structure and the optic nerve that's already functioning, and it's also like depend on the examination. If she can share the test that
Mhm.
he has been done before, we can just give some suggestion and evaluate the case and come back with the right suggestion.
The right protocol, yeah. So Eve
Yeah.
also asked, is stem cell therapy a specific treatment to the vision only, or are we able to receive this treatment for development delay and motor skills? So Eve, tonight, we're talking only about optic nerve conditions, but stem cells can help development delay and motor skills. Last week, we did last week, no, last 2 weeks, we did a webinar specifically for cerebral palsy and also motor skills and delays. So yes. And she also asked, how are we able to determine whether it's CVI or damage of the optic nerve that cause his vision to be affected?
So like the cause of the damage or should be run a lot of examination before, from the OCT to the MRI to the clinical examination, which a lot of our patients they already done this and they are trying
Mhm.
like to search for treatment. But in case they are not in that level, they are still on the diagnosis period, then we can give them some suggestion of doing a certain examination at their home or even like at their convenience. And we also like personally I can uh, give them some suggestion for how to do or what to do next.
Perfect. Well, thank you so much, then, everyone. It was a pleasure to have you guys today with us. Thank you, Dr. Mohammed.
Thank you, Marla.
Thanks. See you guys next time.